Can you imagine what would happen if the waste filtering system in your city went berserk? There would be not so nice things everywhere. Now, consider the waste filtering system in your body going haywire. Not a pretty picture, right? Your kidneys are the waste filtering units in your body that keep you healthy. If anything happens to them, your body gets filled with toxins. Over time, this will be fatal. But how do you know your kidneys are working fine? In today's video, we are going to talk about toxic kidneys and signs to spot them. Make sure you watch until the end. One, blood in your urine. Did you just pass pink or red urine? Well, unless you've eaten beetroots before, it is a sign of concern. The presence of blood in your urine is not normal. It can point toward a few health-related symptoms. One of them could be a sign that your kidneys are toxic. When the kidneys work efficiently and effectively, they filter the waste out of your blood. But if your kidneys are damaged, the blood can leak into your urine. Blood in your urine also points to things such as bladder cancer, tumors, or an infection. Kidney stones could be another reason for this. If you see blood in your urine, it's important to consult your doctor immediately. They will figure out if it's damage to the kidneys or an infection. 2. Puffy eyes and swollen feet. Did you ever wake up with puffy eyes? It could be due to the high-salt dinner you had last night. Congestion and inflammation from allergies could also exacerbate under-eye puffiness. But if you find that your eyes look puffy consistently, it could be directly related to damaged kidneys. When your kidneys are unable to filter toxins properly, a lot of protein can end up leaking. And one of its telltale signs is foamy urine. Since the protein is being wasted away in urine, your body would not be getting enough. One of the affected areas that shows this lack of protein is the puffiness in your eyes. Similarly, when your kidneys are not functioning optimally, it can cause your body to retain a lot of sodium. When that happens, you will see swelling in your ankles and on your feet. Swelling in the lower limbs can also be a sign of other health problems. Leg vein problems, liver diseases, and heart diseases are among them. 3. Back and side pains. Do you constantly find yourself struggling with unexplained pain in the back and on your sides? It could be a sign that your kidneys aren't doing very well. Wondering how these can be correlated? Well, kidneys are located on the sides of your body, nearer to your back. So, when your kidneys malfunction, a common enough side effect is back and side pain. When your kidneys are toxic, they may swell up or become inflamed. Inflammation and cysts can also cause pain in your back. In more extreme cases, it could even be cancer cells that are causing kidney malfunction and the resultant back pain. In short, if you cannot seem to get rid of discomfort and pain in the back, you need to consult your doctor. Don't wait for it to get worse.
Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content.
4. Fatigue. Do you feel constantly tired? No matter how well you slept last night, you still wake up tired. The fatigue doesn't seem to go away, even on weekends. If that's the case with you, don't overlook it. It could be a sign that your kidneys need help. When your kidneys are toxic, they can't filter out the waste and toxins from your body. This leads to a buildup of toxins in your body. As a result, you will end up feeling a lot more tired than normal. You might also face difficulties concentrating at work or doing your daily chores. This is because your brain is not getting enough oxygen from the blood due to the toxins. The kidneys are also responsible for producing erythropoietin. This is a protein responsible for making sure the red blood cells carry oxygen to all parts of your body. But when your kidneys malfunction, they won't be able to produce this protein in the required amount. It means there's a decrease in the production of red blood cells, which causes anemia. This would, in turn, make you weak and fatigued. While we often discuss fatigue in the physical sense, emotional exhaustion can be just as bad. You can watch our video on the warning signs of emotional and mental exhaustion to learn more about them. 5. Lack of sleep. Another problem with toxins remaining in the body because of compromised kidneys is a lack of sleep. The toxins stay in your blood and reach all parts of the body, including those that ensure you get a good night's rest. You would also be forced to wake up regularly during the night, which would disturb your sleep. You may have to pee often at night, which causes disruptions in the sleep cycle. Sleep apnea is also very common among people with kidney disease when compared to the rest. It is a serious sleep disorder in which your breathing rapidly stops and starts. If you feel tired even after having slept for a good amount of time, it probably means you have sleep apnea. 6. Lack of appetite. There are numerous causes of a lack of appetite. Simple stress at home or at the workplace could be causing it, or it could be a symptom of a more serious illness. The accumulation of toxins in your bloodstream as a result of toxic kidneys may be one reason for appetite loss. Because of these toxins, you may lose your sense of taste. As a result, you may not have any inclination toward eating food. A lack of appetite could lead to the rest of your body not getting the nutrients it needs to function properly. If not tackled quickly, you might even end up losing an unhealthy amount of weight. While it may be difficult to pinpoint the reason for your lack of appetite, you can take other factors into account and figure out the cause. Your doctor would check for other symptoms and determine if it's kidney disease or some other issue that needs to be dealt with. 7. Itchy and dry skin. Although the kidneys seem unlinked to the rest of the body's functions, they play a vital role. When the kidneys remove the toxins from your body, they make sure the blood remains pure and allows oxygen to be transported freely. This also makes sure your bones are getting the right amount of minerals from the bloodstream. But when your kidneys don't perform this function properly, your bones no longer get the required minerals. This can cause dry and itchy skin. If you see this symptom, it's a sign that your kidney disease may have reached an advanced stage. The imbalance in the minerals causes your skin to become dry. You will need to check with your doctor to make sure this is resolved before the kidney disease advances into serious malfunction stages. 8. Muscle cramping. When you play intensive sports, you may feel muscle cramps. This is usually because not enough fluids and electrolytes are present in the body. This is why sports people drink lots of water to stay hydrated and maintain electrolyte balance in their bodies. But if you're experiencing muscle cramps despite not doing any intense workouts, it could be due to kidney disease. Since your kidneys are not removing the toxins completely, there would be an imbalance in the electrolytes in your body. The kidney malfunction could also lead to low calcium levels and an imbalance in phosphorus levels. These play a huge role in muscle cramps. If you keep experiencing muscle cramps despite drinking enough water throughout the day, consult your doctor to determine if you have kidney disease. 9. Urinating too frequently. Don't get me wrong. Peeing throughout the day is important to get rid of toxins in your body. But it should be at regular intervals. Excess of everything is harmful. Too much urination can cause dehydration and the loss of minerals. When your kidneys are malfunctioning, you will have the urge to urinate a lot more frequently than normal. It's not that your kidneys are working overtime to remove toxins from your body. Rather, you will see that it's mostly water that your kidneys are forcing you to expel frequently. This phenomenon occurs more often at night, which in turn disturbs your sleep. If you pee too much or too often, you should get it checked. It could be kidney disease or other health challenges, like an enlarged prostate or an infection. Kidneys are one of the most vital organs in your body. The diet you follow can play a crucial role in keeping them functioning at their best. Interested in knowing more about it? Let's keep the conversation going with a couple more kidney diet-related videos, shall we? Watch If You Have Kidney Disease, Stay Away from These 17 Foods. You can also try our video on 20 Best Foods for People with Kidney Disease. Go ahead, click one. Or better yet, watch both and learn more about the health of your kidneys. Did you know about toxic kidneys before watching this video? Let us know in the comments below.